Thank you very much. It's an honor to be here and present one of my cases. I am doing the digital workflow since about 7 years now. More and more steps are full digital in my office. This is the case I want to present you. It's a case report and it's the story behind the smile of this patient. It was a referred patient to my office, 77-year-old. He had an accident and he has a trauma of his front teeth. The two pillars of the existing bridge, 2-1 to 2-3, are fractured. He had no medical problems. He had a big gag reflex, a good perio situation, and even when his hygiene was not perfect, I chose him for an immediate reconstruction. This was the first time when I saw the patient. The crown on number 2-1 was only provisional re-cemented. And so we took the intraoral pictures, and this was the start panoramic on the left side and the single X-ray on the right side. We could not save these two routes, so we had to go for implant dentistry. The first step I did was to take a digital impression with the Carestream CS3600. So in my office, we take more than 90% of all the impressions only digitally. Then we took a cone beam CT. We have now the really nice CS9600. In this case, we did not take a face scan, but for bigger cases, I also do the face scan now. I really like that I have with the CS imaging software, a software where I have all my data in one patient folder. So I have the volume, the cone beam CT data, I have the STL or the PLI data of the intraoral scans. I have even the pictures I took from the patient, and I can also import files from other companies, from other brands, and also PDF. I will show you how I was importing or exporting the provisional planning from the Carestream 3D imaging software, the PDIP module, to the SMOP planning software, and how I solved the case. So we have here the CS 3D imaging software. It's a small video I will show you. We see the panoramic view on the upper right. And on the left side, we see the volume. And I have done a planning already here. We have the implants, and now we have the possibility to export this data, the volume, the DICOM data, and the position of the implant directly to the SMOP software. So you have to agree that this transfer, that you allowed this transfer. Then the SMOP software, the planning software, will open, and the import will start. You can choose either if you want to import only one jaw or if you want to import both jaws. When the SMOP software is open, the data will upload it to the SMOP cloud. From this moment on, you have access to the planning from every computer you are sitting on, or you even can see your planning on your iPad or iPhone. So you can show or share these cases to persons everywhere on the world. I can also share these cases with my referring dentists and my technician, and we can change the planning if necessary. Now we are in the SMOP planning software, and when I have this planning here, I will show you later how this works. Here the play data from the intraoral scan. I was sending this data to my technician, and then I started to plan in SMOP the position of the implant. The aim of this case was to do a screw-retained bridge. So my dental technician has done a wax up in ExoCAD, and I could import this wax up also in the SMOP software, that I can really check the position of the implant I planned. You see now that the axis of the implants are behind the incisal edge, so it will be possible to do a nice screw-retained bridge with direct screws. Now here we are again in the SMOP software, and this is the situation. You see that we have enough bone to place these implants. This is for tooth number 2-1. We can turn and check the volume. We can show the wax up. And I also often show this planning to my patients, because then they understand what we are doing, especially when we have to do a bone augmentation. We see here on the picture that in the upper part, in the apical part of these implants, we have enough bone that we will have primary stability. This is the safety cylinder, this orange mark. We can surf through the slices and check if we have also behind the middle of the implant or enough bone. The next step was to design the template. Here I show you the design of the template. You can do this by a service center, or the surgeon can do it by himself. It's on time, it's real time here. You show how few time it takes me to do the planning of this template. We have the sleeves. We can change the form of these sleeves. We can slice them a little bit. I do not want that they touch the neighboring teeth. And in this case, I wanted to have a gingival support to have more stability, because it will be an immediate reconstruction. So we create this gingiva support. The next step is to design the clamps. So we need a few clamps on the teeth. And then we connect these clamps when we have positioned them in a good way. The more you go in the undercuts, the more stability you have, but the harder it is to take it out during the surgery. So now we do the buccal or the lingual connectors. Also here, you can design the template how the surgeon wants it. I do most of my cases by myself, so all the workflow is done in my office. The dental technician is only the real dental work, the technician dental work. The connector from one side to the other will be done, and then the calculation of the template. You can print this template by your own printer, or you can send them to a print center. We do it with the Stratasys printer. You cannot sterilize these templates, but these are the best templates in my opinion at the moment. You see how the tissue support was created, and after about 30 seconds, you have the final template. Okay. You see here again on the pictures. And now we want to export also the position of the implants to a CAD/CAM program like ExoCAD. So in SMOP we have the possibility to export these blue scan bodies or the virtual scan bodies. We can export the STL data of the model, of the implant position, and of these scan bodies, and import them in a CAD/CAM program. Here we have the situation now in ExoCAD. And my dental technician was fabricating a provisional acrylic bridge. Here on the models to test if it was fitting, we had abutments, these titanium cylinders, and here is the provisional for this case. So you see all the steps are done till now digital. This is the surgery protocol, and now we go to the surgery starting situation, and then extraction of the 2 teeth. We have the template inside placed. We can really good check on the teeth because of the skeletal design of this template. We have a good visibility, and we also can rinse when we do the surgery. We placed 2 Straumann implants with these little handles. You see the osteotomy for the 2 implants now. Then we also place the implants fully guided. The cooling is really nice also with the template here. And then these 2 abutments, the try-in of this provisional bridge. We had a little help to glue them in, that the bridge is in the right position. This was just after the surgery. So 1 hour after I started, the patient could leave my office with a provisional bridge. So because this patient was referred by a dentist, most of my referring dentists are doing the final work by themselves. 3 months after the placement of the implants, the referring dentist has done this bridge, ceramic bridge, also done in a digital way. The patient did not want to have these shades, so it was a little bit too light for me, but as you will see on one of the next pictures, we had a good result for a 70-year-old patient, a very fast result in a digital way, who was cheaper than the conventional way. And the smile of the patient was really big, so that's the story behind the smile of the patient, and the smile then also of me. So I want to thank to my team, to my dental technician, to SMOP, and of course to Carestream Dental. Thank you very much for your attention.
Thank you so much, Dr. Kurt, for your presentation. Thank you. Thank you for showing us the integration between Carestream Dental and SMOP. We now have some time for some questions. If anyone has a question for Dr. Kurt.
Thank you for a wonderful presentation. The question is, you were talking about the guiding splint, which has an interesting design. So who is doing this design, you yourself or your technician, and what kind of software you are using?
I'm using the SMOP software from Swiss Meda. This is a Swiss company who is working together with Carestream, that you see you can directly export the planning from Carestream to SMOP. and then you can order this design of the template by a service partner. Or if you want to do your do-it-yourself version, that's a possibility in this planning system. You can also design this template by yourself.
Okay, very interesting design with all these bars. And
Yeah, it's the most advanced design of these templates, because most of all the other competitors, they do it the old way. They cover all the teeth, though you have more friction and you cannot really control if the template is sitting in the right place. You cover too much of the gingiva or of the side you're doing the surgery, and with this design you can design your template that you also can do your flap design as you like it. So you can open the flap to the buccal side, and then you have a good view, you have a good rinsing of this side. And yeah, it's, in my opinion, it's the best on the market.
thank you, very inspiring. Thank you.
Thank you.
And Dr. Kurt, how hard did you find the transition to become fully digital?
To go fully digital, well, at the beginning I was starting only with the intraoral scanner about 7 years ago. And then I had an old version from another company and I changed to Carestream, and this was the first step actually by a tool in my office. I worked before with my dental technician who was doing digital process. So we scanned the models with a lab scanner, and from there on was it also already digital.
So step by step.
Step by step. But now we are really fully digital in my office.
Thank you so much. Thank you. Thank you, Dr. Kurt, for your presentation.
Thank you.